Personal informatics tools tend to focus on the individual, but public health research tells a different story. Our health is deeply influenced by the people around us. In this work, we develop a framework, one that reimagines personal informatics, transforming them into tools that don't just track users' personal data but amplify the power of the user's social environment. Let's use physical activity as a case study. It's an important health behavior that reduces the risk of chronic diseases and enhances your mental health. But many people couldn't meet the recommended physical activity levels, about 150 minutes of exercise every week, especially people of low socioeconomic status backgrounds. Moreover, many personal informatics tools were designed to support physical activity. However, several systematic reviews found that such tools are often used by individuals on their own with no social features. As a result, people are constrained to leverage the positive social influences around them. This might explain why a recent systematic review found that digital tools for promoting physical activity are less effective in low socioeconomic status populations. By putting health behavior change solely as individual responsibilities, we put the burden of health behavior change on individual people. And this is challenging for people with low socioeconomic status because they have limited means to live a healthy life, which often costs time and money. For example, this mother said that using a personal health informatics app is challenging because she needed to earn living wages, she needed to handle household duties, and she needed to take care of her kids. Using a personal health informatics app was difficult because she had to prioritize many other things. This phenomenon broadly is known as social determinants of health in the space of public health research. People's living and working conditions greatly affect their health. Oftentimes, these social factors play a larger role in people's health, even more than individual factors like a person's genetics and biology. That being said, the burden from the social factors can be lessened by protective social factors. Protective social factors include social support from family, friends, and community members. A close knit community that supports each other can enable the members to overcome the barriers to live a healthy life. Therefore, the overarching question is how can we incorporate protective social factors into the design of personal informatics tools? We proposed the Socio-Cognitive Framework to bridge this gap. This framework is focused on how personal informatics can facilitate social interactions that enhance users' cognition towards improving their ability to manage their health. There are five concepts in this framework: aspirations, belongingness, data exposure, stories, and impediments. But before we go into the details, let's talk about the basic assumptions of this framework. The socio-cognitive framework is based on our 7 years of research on designing and evaluating socially enabled personal health informatics tools for families in low socioeconomic status neighborhoods. A total of 153 people participated. The studies in this research project has been published in CHI and CSCW, and this framework integrates the finding across all these studies. Although the studies were about physical activity, the framework is informed by Bandura's social cognitive theory. Therefore, it can be applied to many other health domains. Social cognitive theory says that if your self-efficacy and outcome expectations to do a task are high, then you are more likely to act on that task. Both self-efficacy and outcome expectations are influenced by our social environment. These are the details of the five concepts. First, we should align personal informatics tools with users' aspirations. Yes, aspirations are about the individuals, but it's common that our aspirations are related to other people. Aspirations are socially situated. For example, some parents did healthy behavior because they want to support their kids to do the same. They saw that if their kids are healthy at a young age, they will be healthy adults. Some parents prioritize their kids' education because if their kids do well at school, they will be financially stable adults. What that means is personal informatics tools should be designed to make sure that these ranges of aspirations are met and these aspirations are socially situated. Second, personal informatics tools should allow users to socially connect with each other to help them stay engaged with the tool. Belongingness, or this desire to socially connect with others, is an innate human need, and when this need is supported when using a personal informatics tool, then people have stronger reasons to continue using the tool. For example, this mother liked using Storywell, an app that we developed, because the app felt like a treat because it allowed her to connect with her kids as a family. Next is exposure to peer data or data exposure, which help users to be more informed when setting their goals. As a result, their goals would be more grounded in the reality of their life and in their community. So, for example, this mother felt that being able to see the fitness steps of her neighbors informed her to set gradual goals. However, we emphasize that supporting comparisons require careful considerations, and we discuss this in great length in the paper, so please check out the paper. Fourth, stories. When people see stories from others in a personal informatics app, they learn new information that can enhance self efficacy and outcome expectations about the health behavior. For example, this is one of the stories that was shared by one of the families in the Storywell app that we developed. This mother talked about Zumba and how she initially found it challenging, but after she kept on trying, she enjoyed doing Zumba. This is what another mother said after listening to this story. She went to YouTube to watch Zumba videos to try with her daughter as well. Just by listening to how the other family tried to be active, she modeled her behavior to the story. And we suggest that stories carry valuable information for social modeling. These pieces of information are task, emotional, and normative behavior information. And we suggest that stories have these vivid pieces of information that could motivate the listener to live a healthier life. But what is it about stories that are particularly impactful? Storytelling is a narrative ways of knowing that complements the pragmatic ways of knowing. Both modes are useful for us, and it's valuable for personal informatics tools to support both the pragmatic and narrative ways of knowing to support health behavior. Lastly, impediments. Marginalization creates impediments that limit the user's ability to perform the health behavior. And we suggest that the design process of personal informatics should identify and address inequities that limit the effectiveness of personal informatics tools. And more importantly, we suggest that we should develop personal informatics tools with the community who will use the tools to make sure that the tools are effective. In conclusion, by designing around aspirations, belongingness, data exposure, stories, and impediments, we can create socially enabled personal informatics tools that amplify protective social factors, which in turn supports health behavior. We invite you to read all the details in our Tokai paper and also to test and refine this framework. We hope that this framework will spur the creation of tools that help more and more people to live healthier lives.